What's our state of health? New South Wales goes to the polls on Saturday, March the 28th, just 5 months away. And tonight we start a series of pre-election debates on the major issues facing voters. In health, there's relentless demand for services from an ageing and growing population. There's deep concern over future funding from Canberra, the local impact if the Abbott government's proposed $7 GP co-payment gets up, elective surgery waiting times, the nurse-to-patient ratio, and an allegation about the Americanisation of hospitals here. Shortly, a studio debate. First, this health report.
Life expectancy is going up. In fact, healthy life expectancy has been going up as well.
After years of public alarm about the runaway costs of healthcare for a growing and ageing Australia, latest stats show there may be a slowing in expenditure. The Grattan Institute's Dr. Stephen Duckett says that's welcome news.
What we're seeing is that the sort of hyperventilation that's been occurring, saying, you know, the health system is unsustainable, is just not supported by the evidence. What we're seeing in this first year, or in the latest year of data, is that it is possible to moderate health expenditure. And what's also interesting is the same sort of pattern has been happening across the world.
Defending their stewardship of New South Wales health over the last 4 years is Premier Mike Baird and Health Minister Gillian Skinner. This list includes major upgrades now underway for hospitals around the state, in what the government claims is nearly $5 billion in capital works since March 2011. And starting this year are said to be big upgrades at Westmead, Gosford, St George and Sutherland hospitals. Since coming to office, the Coalition's claiming a 20% increase in health operational expenditure to $18.7 billion 2013-14. That's Nepean Hospital, that's being upgraded.
That's right.
Significantly, Brett Holmes of the often critical Nurses and Midwives Association acknowledges the government has increased the nursing workforce, seen as vital to quality assurance.
Yes, that is a great improvement to where we were. We were able to negotiate at least 1,600 of those additional positions into the health system as part of our nurse-to-patient ratios claim with the previous government. And Gillian Skinner and her government have delivered on that promise, and they've delivered some more nurses.
But there are major problems for New South Wales Health with future funding from Canberra.
The Commonwealth has said it's no longer going to share in the risks of hospital activity growth. And so rather than having an alignment of objectives between the Commonwealth and the states where they both are concerned about reducing the cost of hospital care, now the Commonwealth has said we're going to wash our hands of this. We're just going to give you, money based on population growth and CPI, which is very, very, very unfair.
And there's the contentious $7 GP co-payment.
Clearly, it's an attack on our universal healthcare insurance system, Medicare.
I think there's nothing to recommend the GP co-payment whatsoever. I mean, just to give you one example, if just 1 in every 50 people who don't turn up at a GP end up being admitted to hospital, then there's no savings whatsoever to the health system because hospital care is so much more expensive.
The biggest local point of policy difference for voters to consider at this state election may turn out to be the Baird government's public-private partnership for its new Northern Beaches Hospital at Frenchs Forest. The site's been acquired, construction's due to start next year. This hospital will be operated by a private health services corporation expected to be either Ramsay Health or Healthscope, both ASX-listed multinationals. Under this PPP model, there'll be a 30-year contract signed by the state government. Patients not privately insured will be admitted and treated at the government's expense. When Northern Beaches Hospital opens in 2018, Manly Hospital in Mike Baird's electorate will close. Mona Vale Hospital will be turned into a rehabilitation, aged palliative care and community health centre. It's said there'll be 423 beds at Northern Beaches, 100 more than currently available at both Manly and Mona Vale.
The New South Wales Government is privatising the new Northern Beaches Hospital.
But in primetime TV ads, the Nurses and Midwives Association has bagged the proposed Northern Beaches PPP model as the thin edge of the wedge to the Americanisation of healthcare in Australia.
I was devastated when I heard that privatisation was going to occur at my hospital.
Premier Mike Baird has attacked this as dishonest advertising.
I think Premier Baird's not actually looking at the big picture. We have one of the world's best health insurance system through Medicare. We have an excellent public health system. But if it's constantly eroded by a push to privatisation, if there is a separation of a two level of care situation, one for the private, one for the public, and that the insured get a better deal, then we'll see the disruption, the destruction of our health system as we know it and as the Australian people value it.
The Grattan Institute's Dr Stephen Duckett.
I think there are two parts to it. First, as long as it's publicly funded and the public has access to the hospital, I don't think it is a cause for concern. I don't think it is Americanisation in that sense. If you can get efficiencies in the public hospital, you should look for them. What is a cause for concern, though, is our track record on these public-private partnerships in the hospital system isn't very good, because you have to specify in advance in a contract everything that you're going to purchase from the private sector, and that's sometimes very, very hard to do. And New South Wales has experience with a bad public-private partnership in the Port Macquarie case. So as long as the state government has learned from that experience and is actually writing a better contract, I think it's okay, but we don't know until we see what comes out of it.